Up next, you see it on the court and on the field. Now the tape that helps pro athletes and their injuries could actually help you.
Could something as simple as tape give you relief from all sorts of physical aches and pains? For many professional athletes, kinesiology tape works wonders, and it's now making its way into rehab practices for the average person. CBS 2's Dr. Max Gomez shows us what tape treatment is all about.
You may have seen it on NBA star James Harden's shoulder and thought it was an odd tattoo. But then you noticed it on other athletes' shoulders and knees, backs, necks, even hips and bellies. What the heck is that?
They typically call it the magic tape. So once you put it on them, they say, "Are you sure there's no medicine in there?"
It's called kinesiology tape, and it's actually been around since the 70s. It can be applied almost anywhere, legs, ankles, neck, shoulder, pretty much anywhere there's musculoskeletal pain. It's given relief to Zach Rapp's multiple pain issues.
The pain is very severe. Depending on if it's my neck, I can feel it more in like my spine. If it's my lower back, I can feel it in my hips. And when that pain, occurs, it's like even when I'm walking down the street, I'll have to stop and actually like stretch my hip, or I shouldn't crack my neck, but I will.
Today, Zach is having his shoulders taped to ease the pain he gets from a very common problem, bad posture at the computer.
As the tape recoils back, it's going to pull the shoulder blade back this way. So when he goes into his bad slumpy position, go ahead and just go into your computer position. See how that stretch on the tape is going to actually pull on the skin, giving him some neurosensory feedback, which should be uncomfortable, and then it's going to help him fire these muscles.
The theory behind the tape is that it improves blood flow by lifting the skin. Or maybe it stimulates nerve fibers in the skin that send signals to the brain that arrive before pain signals, blocking them.
It's been a huge change for me, so it's been great.
But scientific studies on the tape haven't shown much objective benefit, calling the tape effect mostly psychological. Athletes, though, say that even a placebo effect that reduces pain is still a good thing. And besides, there's no real downside to it. Dr. Max Gomez, CBS 2 News.
And Dr. Max says that the tape is typically applied by a physical therapist and usually stays on for 5 to 7 days before having to be reapplied.
Some days it could be a whole bodysuit, right?
Feels like it.
Just put the whole thing on, as long as it works. All right. Well, the famed Broadway